everybody's wanting to know, well, maybe not everybody, trans masculine people on testosterone or going on testosterone or whatever, those people usually are the ones who want to talk about this subject. So hopefully this isn't an overly triggering subject for a lot of folks. I will refer mostly throughout the video to the monthly as a cycle, although I have to make damn sure that we understand exactly what I'm talking about. So the medical term for what we're talking about today is the menstrual cycle. But for the rest of the video, I will be referring to it as the man cycle or just the cycle or the monthly or whatever. But gotta be clear in the beginning that medically speaking, this is what we're talking about today. So, if you're a transmasculine person, and you're on testosterone or going on testosterone, thinking about it, whatever, you may be curious to wonder why yourself or someone you know or someone you heard of may still have a cycle even after they have started testosterone, because isn't one of the benefits of testosterone that it stops? So anyway, the truth of the matter, the kind of sucky thing about testosterone therapy is it is not guaranteed to stop your cycle. It does not mean that necessarily that you are doing something wrong or your provider is doing something wrong or there's something wrong with your medicine or something like that if you do continue to have one even after you've started testosterone. So even in the most perfect world, perfect scenario, you got perfect testosterone blood levels and yada yada yada, even then, up to about 20-25% of transmasculine folks on testosterone still have a cycle. So if you're one of those, it sucks. Now, there are things that I've discussed in another video. I think that I called it transmasculine cycles and what to do about them or something like that, where, I discuss if your blood levels of testosterone are perfect or not perfect because, they're non-binary, so you don't have those high levels to suppress that cycle. Anyway, it discusses options of things you can do to help mitigate the cycle, perhaps. Nothing's guaranteed. I can 100% tell you that as long as you have the parts that can end up having and initiating a cycle, there's a chance that you'll have either continue to have regular ones, irregular, or, anywhere in between. Some people can go for months and months and not experience one. Some people, it's, an every 4 to 6 weeks thing. It's really the luck of the draw. And like I said, as long as you still have those parts, it can still happen. But anyway, if you're interested in how to, potentially mitigate that thing and maybe be able to get it under control, go watch the other video that discusses different types of medications and things you can do. One other thing I'll mention on here is just like, why are some other reasons, if you're just like, well, that's really great to hear that 25% of transmasculine people could just have it, but I want to make sure that there's not something else going on before I just call it a day and give up on, controlling it or whatever. So what are some other things that could have potentially triggered a cycle to restart or start or whatever? So it's relatively limited in normal circumstances. So you could be on low dose testosterone or non-binary androgynous dosing. Those are generally not going to produce the kind of testosterone levels in the bloodstream that are going to actually fully suppress a cycle. So, that is one thing. If you're doing more of a low or slow dose type thing, probably not going to be able to suppress it like those who are on the more full dose therapy. And in that case, if you're interested, you should check out the other video of maybe some possibilities on how to get that to stop if you wanted to. Some dudes are perfectly fine with it. Anyways, the next thing to be aware of that a lot of folks don't seem to be aware of is that, if you're having a cycle, more tea doesn't necessarily equal better tea. It doesn't mean that it's going to stop the cycle. You know, like if you're having one, it doesn't mean necessarily that your levels are too low or that, you know, you need more medicine in order to stop it. In fact, that may be the problem right there, because what can happen is, like, let's say you're on testosterone, your levels are, I don't know, like, just for point of reference, you know, depending on timing of when the labs are drawn and when you give like a shot, for example, your testosterone levels could range anywhere from 300 to 1,000, depending on the timing of the draw and when you took your dose and all that. But let's say that your levels are pushing up in 1,500, 1,800 level range, or even higher. You know, I've seen some crazy stuff out there. So the problem with this is it can cause all kinds of funky stuff in your body, not just related to cycles and stuff, but it can cause some vascular issues as well. But today we're just talking about this. So anywho, so the problem with elevated testosterone in the body is that most folks, your body is going to look at that and go, hey, I got some extra testosterone. I'm going to convert that into some estrogens. So that's where estrogen comes from in the body, actually, is it gets converted from testosterone through a process called aromatization. And so you have testosterone becoming estrogen all the time, but when you have way more testosterone than usual, this could happen at a more advanced or rapid rate, raising your estradiol levels and and the rise and fall of estradiol levels are by and large what is going to cause a trigger of a cycle. And so having these elevated testosterone levels higher and higher may not be the best choice here. So this is one of those reasons why, you know, talk to your healthcare provider and all that. Because more tea doesn't necessarily equal better results or better cycle control. Another thing just to mention here is that if you've changed from one method of testosterone to another, some people will get a temporary resurgence of a cycle or permanent or something like that. So here's an example of something that I see quite often. Someone is on injections and they get tired of injections. I mean, hey. And they had good cycle control on the injections, and then they go to a cream or a gel, some kind of topically applied testosterone, right? And all of a sudden, a couple months after they have started the topical testosterone, now their cycle starts kicking up again. So why could this potentially happen? I see it a lot on creams and gels. I'm not saying that cream or gel is ineffective for transition, but from what I see with the hundreds of patients that we've seen here is that cream/gel or whatever kind of topical that you're on that's applied daily especially is not as efficient at controlling a cycle. Now, why could that be? Usually that's going to be like when compared to injectable therapy, you give yourself an injection usually once a week, but we'll find some people every 10 days or 14 days, whatever, but let's say you're giving it once a week, your levels are nice and up, and they stay that way, just slowly coming down toward the end of that week, right? So your levels are up. On gel or cream, you apply it every single day, and so your T levels are going to go wee, up and down. So because of this constant up and down, it seems to kind of open the window or crack the door open for a cycle to kind of slip on through then, because if your T isn't, you know, consistently average above a certain level, it's probably not going to suppress that cycle from happening. Now, I mean, does that mean that if you go on a topical testosterone that it will happen? No, not necessarily. You know, like I said, that's a common example that I see happen a lot, is that people go from injections to topical and they end up having some kind of a resurgence of a cycle. Some of them, not all of them. And it's true too with people who start off and they're on, you know, cream or gel or whatever from the get-go. They may initially see that their cycle gets disrupted, but then it may come back on down the line. Again, as I mentioned earlier in the video, if you have the parts, it can happen almost no matter what. No matter if you're on a great T therapy regimen and you're on some of the other measures that I mentioned in another video for, you know, controlling a cycle, sometimes it can still just happen, and the only way around it is getting those parts taken out, which some people are not okay with. So it's one of those things that you have to like learn to manage on your own, either mentally or physically, either through medications or surgery or whatnot. Keep in mind that guys bleed too. You know, it's one of those things that I wish society would get out of the mindset of thinking that only, you know, women bleed. No. Like, no. You're a dude, you bleed, it's great, okay. It's just a thing. You were born with certain parts, they're there, they're gonna do their thing, you know. But anyways, so I hope that was kind of helpful in understanding why cycles may happen, and let you know that you are certainly not alone, that there's a large chunk of transmasculine people that are in the same boat. And like I said, check out the other video if you're interested in ways to maybe help manage or mitigate that if possible. All right, y'all have a fun day. Bye.